Hi, this is Kerby Anderson. You know, each day we take on the tough issues and provide a biblical perspective to them. The topics we cover are wide-ranging: apologetics, theology, prophecy, creation and evolution, intelligent design, marriage, family, child-rearing, the millennial generation, friends and society, politics, economics, business, religious liberty, the Constitution, public policy, foreign policy, military policy, tensions in the Middle East, abortion, homosexuality, pornography, sexual ethics, media, technology, history, and America's godly heritage. We talk about anything that affects your faith, your family, or your freedom. So don't go anywhere, because Point of View starts right now.
Across America, live. This is Point of View. And now, Kerby Anderson.
Thank you for joining me today. It is Thursday, and it is our National Day of Prayer. Right now, for those of you that maybe wanted to listen to the National Day of Prayer virtual event, it is taking place right now at the Hope Center. You can go to the Facebook page and see it. Actually, all of it is already loaded, so you could actually watch what you wanted to, fast forward past other pieces, and, of course, you can watch it later. So whether you want to stay with us or listen to some of the material from the Hope Center, let me mention that this is the National Day of Prayer. It is the first Thursday of May, and that's why it's taking place today on May 7th. It was instituted really in a historic way back in 1952 by Harry Truman, but it then began to be formalized under Ronald Reagan in 1988 when they actually signed a bill designating the first Thursday of May as this time of prayer. But even before we had that, we have had really all the way back to when the First Continental Congress gathered in 1775, called on the colonists to pray as they considered how they would respond to the King of England. Then the commander-in-chief, George Washington, called for various times of prayer. It later became the president, called for times of prayer. More than 130 different national calls for prayer, humiliation, and fasting. There have been at least 60, almost 70 now, presidential proclamations during the National Day of Prayer. And so this is something we have been talking about for the last couple of days and wanted you to participate in one way or another through some of these virtual events. Right now, of course, the Hope Center one is taking place. Let me just mention that tonight there are actually two. I thought they were all the same thing, but there is one that takes place at 6 p.m. Central, which includes just a lot of people we've interviewed on this program, whether it's Jack Graham or whether it's Greg and some of the works that he's been doing there at Harvest, or whether it's Eric Metaxas, the long list of individuals that are all part of that event. It looks like it's put together pretty much with Greg Laurie and Pastor Jack Graham, but there also is one at 7 o'clock on television, which seems to be a little bit different, and that's the one that Will Graham is the MC for, and a variety of other things. So I just thought I'd mention the other ways in which you can participate today in this National Day of Prayer. Let me give you kind of an overview. In just a few minutes, we're going to talk about this idea of health and Watermark, which is a church in this area, in the Dallas area. We'll be talking with the executive director of Watermark Health, Christy Chermak, about the ministry that they have there. So we'll get into that conversation. Next hour, we will have Mark Hitchcock with us. Originally, we were just going to spend some time talking about his new book, Showdown with Iran. But then arriving in my box just yesterday was this other one called Corona Crisis. I am always amazed that when publishers really want to work hard, they can get some books out very quickly, because he finished writing that in April. And if you look down on our schedule, it's May 7th, and we already have a book in print on the whole issue of the pandemic and some of its, if you will, prophetic significance. So we'll be talking about that with him. And then we just move back an interview we were going to do in the first hour to the second national hour, and that will be with Rachel Gilson, Born Again This Way. And then I'll come back with some other comments about the pandemic as well. So lots to cover. And in this half hour, let me cover a couple of things. And the first is that over the last couple of weeks, I've mentioned that still there are a lot of counties which did not have a COVID-19 infection, and even a fewer number of those that have had a death. And the numbers just came out the other day. Since I heard a couple of other talk show hosts mention them, I will give them to you as well. And that is 1,639 counties in the country have not had any deaths due to the coronavirus. 52%. If you add then the 447 other counties in this country, which makes up about 14% that have had one death, you could say then that adds up to two-thirds. Two-thirds of the counties in this country have either had no deaths from COVID-19 or one. So you can begin to see that they really are very definitely concentrated in a few areas. Matter of fact, somebody did a study, and this one goes back to May 4th, so it's slightly off by a few days, but it was accurate at that time, that if you just look at the states of New York and New Jersey, they accounted for 38% of all the cases and 48% of all the coronavirus deaths. If you add 5 states, which would be New York, New Jersey, Massachusetts, Illinois, and California, that accounts for 54% of all the cases and 61% of the coronavirus deaths, which kind of brings us back to one of the things that was posted yesterday. It was by Brett Stevens, and I mentioned this on the program before, that he says, you know, even though I live in New York City, even though I write for the New York Times, I don't think that the entire country should live based upon New York rules, and I think those numbers illustrate that only so well. But my first article is one in which one of the writers, Brandon Morse, has been very upset that the governor of the state of California, Gavin Newsom, has been saying we're not going to go back to normal. We might go back to something that he calls new normal. Now, we all recognize that the future is going to be different, but what he means here is that we are going to go into a new normal, and that we will not even come close to something he believes that looks like normal until we get immunity and a vaccine. And so there is a sense that we're now seeing people say that unless we can prevent any more deaths, we will still have these draconian restrictions placed upon the people in that particular state. And the argument that Brandon Morris is making is that the governor, Newsom, and others have tasted real power, he says, and not likely that they're going to give it up without a fight. And it's a fight they'll get. The fight itself, however, will be the situation of how to actually bring us back to something that looks like normal. And he says, this is all well and good. As I've written before, human nature will eventually cause people to forget precautions as we get used to living with the virus, and more information dilutes the fear around it. And so he's really arguing that people will begin to question the necessity of all these rules and regulations, and people will either demand governments alter the laws, or they'll be like the Dallas salon owner Shelley Luther, and they'll just continue business as they did anyway. The concern I have with that is that I think he makes a point early on that people might get used to it, and that's exactly what I think is taking place. I watched last night Channel 8 News, WFAA, and they always give you a chance to weigh in on different polls, and one of those questions was, do you think the punishment for Shelley Luther, the individual of that salon, was appropriate? I mean, again, recognize $7,000 fine, 7 days in jail, no even bail before you could even appeal that, which I think was pretty strong. And yet 3/4 said, yes, they thought that was appropriate. And so I think if you have people scared that they can go out and die, and they are concerned that we all have to obey, then you had very few people last night in the survey thinking that that just maybe was an overreach, which was, of course, the argument being made by the lieutenant governor and even by the attorney general, but was not shared by a lot of the viewers on Channel 8 News. So, if nothing else, people sometimes get very used to all sorts of restrictions. Look what's happened at TSA. So, this will be interesting to see how this plays out in the next couple months. We'll be right back.
This is Viewpoints with Kerby Anderson.
Today is the National Day of Prayer. It is a vital part of our American heritage. The first call to prayer happened before the American Revolution. In 1775, the Continental Congress called on the colonists to pray for wisdom as they considered how they would respond to the King of England. Perhaps one of the most powerful calls to prayer came from President Abraham Lincoln during the Civil War. In 1863, he issued a proclamation for a day of humiliation, fasting, and prayer. Here is some of that proclamation. He said, "We have been the recipients of the choicest bounties of heaven. We have been preserved these many years. In peace and prosperity, we have grown in numbers, wealth, and power, as no other nation has ever grown. But we have forgotten God. We have forgotten the gracious hand which preserved us in peace and multiplied and enriched and strengthened us. We have vainly imagined in the deceitfulness of our hearts that all these blessings were produced by some superior wisdom and virtue of our own. Intoxicated with unbroken success, we have become too self-sufficient to feel the necessity of redeeming and preserving grace, too proud to pray to the God that made us." In 1952, Congress passed and President Harry Truman signed a resolution declaring an annual National Day of Prayer. In 1988, President Reagan signed into law a bill that designated the first Thursday of May at the time for a National Day of Prayer. It is estimated that there have been more than 130 national calls to prayer, humiliation, fasting, and thanksgiving by presidents of the United States. There have been 60 presidential proclamations for a National Day of Prayer because every president has signed these proclamations. Today is the National Day of Prayer. Please pray for this nation and its leaders. I'm Kerby Anderson, and that's my point of view.
For a free copy of Kerby's booklet, A Biblical View on Socialism, go to viewpoints.info/socialism. That's viewpoints.info/socialism.
You're listening to Point of View, your listener-supported source for truth.
Once again, let's, if we can, for just a few minutes, talk about what this new normal might look like because of a survey that was done recently. And then we'll look at 4 things that have made the coronavirus pandemic worse. And then we'll get into some of the material from Watermark Health, which has actually established a drive-through COVID-19 testing site at Watermark Community Church. And we'll get a little bit more information about Watermark Urgent Care and a number of other things. And, of course, this is our National Day of Prayer, so I encourage you to take the time to learn a little bit more about this National Day of Prayer, to pray for this country, and maybe even participate in some of these virtual events. There was a survey done by Vital Vio, which was a survey of about 1,000 U.S. adults, and so that's enough to give you an indication. It's not the most extensive survey, but it was one that I have quoted a couple of times, and so I thought it would help us understand that this new normal is going to be different, and it's illustrated by the fact that they began to ask people questions about, as we come out of lockdown, what do you plan to do? And according to their research, about 40% of Americans plan to avoid public spaces unless absolutely necessary, long after even the coronavirus pandemic has subsided. So the writer here, John Anderer, said, here's hoping you enjoyed your last movie or concert you attended, because guess what? A lot of people are just simply not going to go out there. And again, it's a survey of about 1,000 U.S. adults. And this is only a snapshot.
It's just a quick response. It doesn't necessarily mean that this is exactly what will happen. But if you take the data, it is fascinating because, first of all, they found that about 4 out of every 5 people, 82%, said that they are now more aware of and concerned about cleaning protocols in public arenas. And you probably would agree with that. They found additionally 58% are more suspicious about their friends and family's hygiene habits. And I love what he says here. Next year's Thanksgiving could get real interesting. But here's the one that I thought I would get to. I said this to my wife the other day, and she said, that just can't be right. But some 16% of the respondents went so far as to say they're unsure if they will ever feel comfortable going out in public again. Now, you might say, well, that just is only their initial reaction. But first of all, a third said they'd wait a few weeks. 26% said they might wait a month or two anyway. But you have 16% that say they're very unsure if they'll ever feel comfortable going out in public again. Now, you have to understand that some of that has to do with the fact that if you're elderly and you've already been told that you may be quite vulnerable to getting the virus, you're not going to want to go out. If you are in a nursing home, maybe now you're saying, well, my kids or grandkids can come visit me, but I'm not going out again. Then you have a percentage of people that have what we call agoraphobia. This existed before we had a pandemic. These are people that don't like to leave their house. They don't like to go out in public. They have a fear of the agora, the open spaces. And so has this pandemic, has this lockdown made that problem easier, or has it made it worse? And I think you know the answer to that. So you can begin to see how that 16% figure is pretty interesting and something we'll be watching over these next couple of weeks and even months. Then, what about cleaning? Well, they found that 83% of Americans are inclined to buy more chemical cleaners and disinfectants. No surprise there. Most of the respondents said they're going to hold businesses accountable for how they clean their spaces, and a majority said they wouldn't even patronize establishments that aren't transparent about their cleaning practices. And again, most of that makes some sense. And nearly all the respondents, 92%, believe virtually all businesses should make hand sanitizer widely available for customers. Lots of luck trying to find that in some areas right now. And 78% think businesses should hire more cleaning staff. And so those are all just kind of for the general office workplace. One more comment before I move on. A significant portion of the respondents also worried about their children's safety once schools reopen. A quarter, 27%, will wait a few weeks before sending their kids back to class. So if indeed that's the case, let's say right now we're hearing the governor of the state of Texas, Greg Abbott, saying we might start school earlier in August. And I'm thinking, you might start it earlier in August, but some of the parents might say, we're not sending them until we are really sure it's safe. You might have some pretty empty-looking classrooms if that's the case, if indeed these numbers hand out. 24% said they'd wait 2 months. So you can convene class in August, but you're not seeing them until October. I mean, just start thinking through the implications of this. And there is just a lot for this so-called new normal that is on the horizon, and it's going to be something that we'll certainly be talking about here on Point of View. Just before we take a break and we get into some of the things that Watermark Health is doing, let me talk about very quickly 4 things that have actually made the coronavirus lockdown and pandemic worse. This actually comes from USA Today, and you can read it in its entirety. But the first one, no surprise there, density kills. I sort of already alluded to that. The coronavirus, as this writer, Glenn Harlan Reynolds, who I know, says is really much more deadly in, of course, New York and in Boston. One demographer, Joel Kotkin, who I'm going to quote a couple of times here, notes that Los Angeles has done a much better job than other big cities. Even though it's the second largest city, it's much less dense, and as a result, the number of infections and death are much lower than you see in a place like New York or Chicago or other places. Number 2, mass transit kills. Again, Kotkin, who I mentioned just a minute ago, mentions mass transit, and in an MIT study found that the New York City subways were a major disseminator of the coronavirus in New York. And, of course, this is if you've ever been on these subways, and I have, they're crowded, they're poorly ventilated, and up until recently, they didn't clean them, if you can't believe that. Now they actually shut them down at night to clean them. What a great concept. But nevertheless, that's the case. Number 3, Glenn Harlan Reynolds points out, bureaucracy kills. Again, he tends to be kind of on the liberal progressive side, but he's got to admit that this is one place where government hasn't been the solution. Government has been the problem. He said much of the fight against the coronavirus has also involved a fight against bureaucrats dead set on making things worse. Talks about the Centers for Disease Control and Prevention. Actually, because COVID-19 was a public health emergency, they raised the bar for testing requirements. That took a bad problem and made it worse. And again, if you want to blame President Donald Trump, feel free to do so, but I don't think it has nothing to do with his desire, if anything, to try to reduce the number of regulations, but those regulations certainly were not helpful at all. And then number 4, no surprise here, censorship kills. The Chinese government censored reports of the Wuhan coronavirus outbreak, punished doctors who talked about it, lied to the world for weeks while allowing flights from the infected area from Wuhan to go all over the world. And so, again, don't trust China, he says, and don't trust Americans who want to emulate the Chinese government. So, if nothing else, just a reminder of some of the facts that, indeed, we are starting to learn from this issue as well. One last one that we will get into more probably tomorrow, but it is an editorial that appeared actually yesterday, Stay Shut Down or We'll Sue, and that is something I've already pointed out, that we are now, as we are starting to come out of lockdown, as some of the governors are opening these economies, you have all sorts of trial lawyers who have filed suits against emergency supply manufacturers for false advertising, supposedly, against colleges for refusing to refund student fees, against cruise lines because of emotional distress. Even individuals that did not get the virus, it still was emotional distress, they argue. Retailers because of course, wrongful death. Nursing homes because of negligence, and governments because of denial of hazard pay. And so these lawsuits need to be addressed, and Congress is starting to think about whether or not it can provide some kind of liability protections. Otherwise, you can see what will happen. And a lot of these businesses are going to say, look, if you're going to sue me because somebody comes into my store and then subsequently gets the virus, and how can you even prove that they got it in the store and not outside of the store? But you can see how that will just cause a lot of individuals to simply say, we are not going to open up. And right now you have a wrongful death suit that has been filed against Walmart because of an individual that worked at Walmart in Chicago who died. But again, how are you going to prove that because the person got the virus, they got it in Walmart and they didn't get it outside or didn't get it in a family meeting? But nevertheless, this could just tie up the courts and actually make even some attempt to get back to this normal or new normal even more difficult. So we got a lot more to cover. We will do that later on. But when we come back, I want to talk a little bit about what our friends at Watermark Community Church are doing through Watermark Health. And I think you'll benefit from that and appreciate the fact that oftentimes it's Christians on the front lines doing a great deal of good and becoming the hands and feet of Jesus. Let's take a break. We have a lot more to cover, and we will do so right after this.
"2020. Is there anything important happening this year? Well, not unless you consider major disputes in various Christian denominations, international tensions over a flu epidemic, economic uncertainties, and a presidential election important. Question: where will you get real news, credible opinion, clear biblical thinking on the things that matter most? Answer: Point of View Radio with Kerby Anderson and the team. You can make sure their voices continue speaking loud and clear by taking a moment right now and joining the Truth Team. It's easy, but you do have to visit our website or make a quick call. Go to pointofview.net/team or call 800-347-5151. You have the power to make a difference. Joining the Truth Team can help ensure that millions of people will get a different opinion from the major purveyors of fake news. We don't get big advertising dollars like the networks or tax money like PBS. We depend on you. pointofview.net/team and 800-347-5151. Point of View will continue after this.
You are listening to Point of View. The opinions expressed on Point of View do not necessarily reflect the views of the management or staff of this station. And now, here again, is Kerby Anderson.
Going to spend some time now talking about what is actually happening through Watermark Health, and they have actually put together a COVID-19 testing site for uninsured patients. But I thought for just a few minutes we might give you a real overview for what they're doing. Christy Chermak is the executive director of Watermark Health. an individual that went to SMU and also became a Christian in the midst of some of the things that were happening when she was actually working on her degree, master's degree in environmental engineering. Went to Watermark Community Church, has been involved there, and actually now is the executive director of Watermark Health, where they have 2 urgent care clinics, which are actually serving not only the uninsured but the underinsured. And so, Christy, thank you for joining us today here on Point of View.
Thank you, Kerby. Excited to be with y'all.
Talk about the clinics first before we get into the testing site here, because that has been happening even before we had this virus pandemic, hasn't it?
Yes, that's correct. So we have run 2 nonprofit urgent care clinics. Our first one opened up about 7 years ago, and it was basically a little bit of an experiment. There's some members of the church that were involved in a for-profit physicians group. They had a good couple years of just income in the community, and they said, hey, how can we give back to the community? What can we do to serve the city? And so they got in contact with some of our missions and outreach team, what we call external focus here at Watermark. And the idea kind of came forward of, hey, let's do a nonprofit clinic. And so urgent care was a bit of their area of expertise. We had Dr. Matt Bush, who's an ER physician, was very involved, and then a couple PAs that were a little bit more comfortable with the urgent care piece of medicine. But then on top of that, we also saw, just as a church, a gap in accessibility in those urgent care type moments. So there's a number of amazing, excellent primary care clinics around the DFW area. But a lot of folks, if they have something like a rash or pink eye or strep throat, something that needs that quick attentive care, it can be hard to get into one of those clinics due to zip code requirements, income requirements. A lot of them need an ID. Some of them require government insurance. And so we saw this gap of the uninsured, especially, ending up in the ER for some of these things that really weren't emergent. And so that's where we've decided to step in, and we opened up our first clinic about 7 years ago. And got to serve patients, and we've seen it grow to now where we have 2 clinics. We're seeing about 12,000 visits a year, helping to keep people out of the ERs and hopefully save them some money, but then also do pastoral care and spiritual support too while they're on site.
Might just mention we have a link to watermarkhealth.org, as well as information about the urgent care facilities and its location. And then, of course, also some links as well if people want to follow what you're doing, both on Facebook and a number of other ways. And bringing us back to that for just a minute, I think I saw something that said about, 90% of the patients that you actually serve don't have health insurance. So in some respects, people might say, well, why not just go to a clinic? Well, if you don't have health insurance and you don't have any financial resources, very quickly, you don't have any options if it weren't for the fact that you're providing some of those options.
Correct. A lot of those folks are the ones that end up in the ER, because in the ER, you're taken care of, you're treated, you're brought back to baseline, and then you walk out with the debt. You don't have to, like in a normal for-profit clinic, pay on the front end. And so a lot of the folks that are living paycheck to paycheck are able to go there, but they leave with debt. And so we do see, especially in that subset, we see a large refugee and immigrant population. That's who a lot of our patients end up being. About 60 to 70% of our patients are first-generation residents in the United States. And so it's been really cool, really big privilege to get to serve that patient population especially.
Let me again mention that if you find yourself saying, maybe I'm not interested in that, but I know somebody in my community that just lost their job or doesn't have health insurance, and maybe this would be an option for them. There's one in Dallas County, one in Collin County. We have all that information on our website. Of course, you can simply go to her website as well, because it is watermarkhealth.org. And let's then also talk about this idea of testing. We do have some government-run drive-in testing locations, but you've provided one for testing on COVID-19. Tell us more, if you might.
Yeah, for sure. So that's another similar start to how we launched the clinics. We went back to that same partnership with Quest Care Medical Clinics that we did at the beginning. And we said, hey, we see a need for testing. We continue to see public health officials, Dallas city officials, just raising the bar and saying, hey, we need more testing accessibility. And so while there's a couple county resources for some of the uninsured up in North Dallas, they're harder to get to. The turnaround can be pretty lengthy. And so we said, let's partner with Quest Care Medical Clinics again. They've already got multiple testing sites around DFW. They've seen around 5,000 patients in their own network. And we said, what can we do to partner with you guys to bring our uninsured patients on site and get some testing as well? So we were able to open up a testing location here at our Watermark Church Dallas campus. It's drive-through site. It requires a physician's referral. There's a couple reasons for that. The primary one being it means you're doing good medicine. We're not just swabbing someone and leaving them to discern what the results mean for their life. They're getting a chance to talk with a physician about that. They better understand then the percentage of negative tests and what to do with treatment if they're positive or negative, all those details. So it's a referral-only site, but that means physicians from the Quest Care Network are referring in, as well as our physicians at our Watermark Urgent Care Clinic. So the uninsured are getting to come here and get tested for free. And so we're really excited about that. We've seen the numbers continue to grow exponentially as word has gotten out, and we just see that as a way to really serve a part of the population that can kind of be less scrambling when they find themselves in a difficult situation with their health care. A quick example of that would be just yesterday, we got to run the nasal swab test for an area safe home of men that are coming out of the prison system. It's a faith-based organization. We got to help them out by running tests for their entire facility. And so there's just a piece of that we're really excited about to get to step into for folks.
And again, you mentioned it in passing, but let's come back to it again. Patients do need a referral. That's not necessarily a financial barrier, but important.
Correct.
And talk about what else needs to take place, because as I understand, they are tested without even having to leave their cars. But what does this look like for an individual that thinks, I might actually test positive, but I need to know what are the next steps?
So if someone's interested in testing, they can go to our website, watermarkurgentcare.com/testing, or if you just go to the main website, you'll see a banner for it. It'll pop up. Essentially, we're going to send you just some different routes if you have insurance or not. If you have insurance, we're going to refer you to our partners, Quest Care Medical Clinics. They're going to take care of you. If you don't have insurance, you're going to call one of our clinics, and we're going to decide, do we need to physically see you, or can we do the call over telehealth? Our providers will be able to talk through with you any symptoms you've experienced, or if you've been around someone that's been exposed in a close quarter. And then if they and you decide that testing is the right solution for you, they'll send that referral over to our site. Basically, people pull through. We've got cones set up, clear directions, instructions. They pull through the site. Some nurses will come out, verify who we're talking to, verify we got the referral. And then for our patients, we're doing the nasal swab right now, which is testing, do you actively have the virus? Is it still in your system? And so that's semi-uncomfortable process of there's a kind of what looks like a Q-tip that swabs the inside of your nose. And they'll take that lab test, they'll take that specimen and they'll send it to the labs for testing. It's about a 2 to 4 day turnaround process. So in between that process, we kind of guide our patients to give them some good health education on, hey, before you know the results of this, if you're experiencing symptoms, you need to be really careful about sheltering in place, be conscientious of who you're spreading your germs to. Here's some we give them good practices on how to clean their home if there's other people that they're living with, just to try the best they can to limit the spread of that disease elsewhere. And then they'll get a call from their provider within that 2 to 4 day window to help them understand if the test results were positive or negative, and then what to do with that. And so that's kind of what the process looks like. In addition to that, while they're on site, we have pastoral care volunteers that visit with every single patient. They have the chance to just walk them through some of that health education and then also transition the conversation to a spiritual one. We know that right now a lot of people are anxious and nervous. We're constantly have to take our minds back to scripture and truth to refocus on what's true in this time. And so we get to walk through that with our patients and just kind of meet them where they're at, ask them how they're doing, share scripture with them. We have resources we put in their hand on how they can connect to the local church. And then we pray with them, or we offer to pray with them. And so that's been a really big win as a part of this too. A lot of really fruitful conversations of folks that, as you can imagine, are nervous and scared, and we get to remind them of who Christ is in the middle of that.
Let's take a break. Christy Chermak with us. And again, we're talking about watermarkhealth.org and also, of course, watermarkurgentcare.com/testing. So a lot of great material that we have already put on the website. We come back. Christy, I thought maybe we talk a little bit about how people can get involved with you. You may still be looking for volunteers. You certainly could use people to invest into this ministry in one way or another. So I want to talk about that. And most importantly, educate as many people as we can about these alternatives alternatives that exist out there. And perhaps you are saying, well, I have insurance and I'm healthy right now, but you probably know somebody who does not have insurance or is underinsured or maybe has lost his or her job and maybe benefit from some of this information, which is why we're providing it right now. We'll take a break and continue our conversation about Watermark Health right after this.
Now, back to Point of View, your listener-supported source for truth.
Christy Chermak with us for just a few more minutes as we talk about Watermark Health. And again, also encourage you to go to watermarkurgentcare.com. You can find that as well. But Christy, I thought it would be good just before I let you go to talk about how people can partner with you, because I recognize that maybe a few people listening to this right now might say, okay, I would like to know more about that urgent care facility, either the one in Dallas or the one in Collin County, because again, I live in one of those counties, but there are a number of other people listening saying, no, I'm glad to know about that, but I won't probably use it, but I know people that might. But also I recognize we have some individuals that say, I could probably help as a volunteer. I have some background that might be useful. Or how can I invest in this so that we really can use this as an outreach? So as we go to watermarkhealth.org, you have a section there called Invest and a section called Volunteer. Let's talk about, first of all, how people can help you and maybe volunteer some of their time and some of their resources for you.
Yeah, that's a great question. So both of our clinics have been, from day one, fueled by volunteer support. We really do believe that some of the magic behind what's happening in this ministry is because the local church is there. It's not just a bunch of staff that's been hired on full time. We have that staff to be a backbone, but then any kind of volume that comes through our door has historically been managed based on volunteers at our front desk, nurses, providers, whether it be an NP, a PA, an MD, a DO, all different kinds of providers. We have dentists that come on site and volunteer. And then we also have a role on site for pastoral care, which is, can kind of, to wrap your mind around it, can be very similar to what a chaplain would do at a hospital, but it feels very fluid and normal in our visit for someone to pop in and say, hey, how else can we serve you? Can we pray with you? And so all of those roles have been volunteers. Now with COVID-19, we've had to scale some of that back. And so
Sure.
The way that people can show that they're interested once we kind of figure out what this new normal looks like, they could email us at volunteer@watermarkurgentcare.com if they've got a medical background or are excited about getting plugged in that way. We have an orientation process we can walk them through. But we really love that part of our ministry because it's not only a benefit to serve our patients, but we also see this opportunity to build into the local church and help them share their faith, grow in what it looks like to trust the Lord with the day-to-day, and then be an evangelist with the people they meet. And so we see awesome stories come out of that of nurses learning how to talk about who God is in our clinic, and then they take it to their medical environment as well. So that would be one part. And then what I'd also say right now in this season, there are some specific ways people can jump in. One is providing meals. Again, if you email that volunteer@watermarkurgentcare.com, we have some meal signups to help cover our testing site, our existing clinics that are still open. And then we also just started something new with pop-up clinics where we're taking our medical staff to specific areas of need. And so providing meals for the staff is very helpful. It takes one thing off their plate to think about so that it can be freed up to serve the people in front of them. And then, as you mentioned, helping us out financially is also a really helpful way to invest in the ministry happening here. So at watermarkhealth.org, you'll see up on the top banner a place that says invest, and you can see all the platforms there to give. I think some details I would give folks that are interested in this is that it costs us $70 every time we run one of those nasal swab tests, and we're doing that for free. And so we'll only really be able to do that as long as it's an option in our budget. And so as people donate to this ministry, that'll be a way that that money is specifically deployed. Also with COVID-19, we've had to get creative on PPE and find new distributors. And obviously we're buying more of it than we would have during a normal season. And so that's been another expense that we've taken on as a ministry. And so as people contribute in this time, it has historically allowed us, and it will continue to allow us to be creative and strategic in where we deploy the medical professionals we work with. And so we're not stuck in the rut of doing the same thing day in, day out. We know that the whole healthcare system just drastically shifted in front of us. And so we're going to continue being creative about how we respond to that. And I would just encourage your listeners real fast with the fact that the way we've been set up historically is we don't take any government funding. Everything we do is financed by the church, by local members and different people that believe in the mission. And then that partnership with Quest Care Medical Clinics, that's what's been allowed to make us run and fuel this really awesome outreach ministry as well as medical ministry to the city of Dallas. And so the Lord has really shown us just to keep moving forward by the way that he's resourced this ministry. And so we're excited to see what he does during this time as well.
Let me mention again that the drop-down menu there is Invest, and you can give online, or else you can make a check out to Watermark Health, and I would encourage you to do so. Let me come back to not only ministering to the medical issues, but the spiritual and emotional issues. At a time like this, there's a great deal of fear. Of course, in 2 Timothy 1, verse 7, it says that we should not have a spirit of fear, but of power and love and a sound mind. But it seems to me that this is just like it is sometimes in these crisis pregnancy centers, these pregnancy resource centers, even here in your clinics, an opportunity to minister to not just the physical needs of an individual, but the emotional and spiritual needs of them as well.
Yes, absolutely. I mean, that's what we've been doing since day one, 7 years ago, and we've seen the Lord do some really amazing things through it. It's funny you mentioned crisis pregnancy moments. That was actually our very first patient interaction, was with someone who came in, thought that they had flu-like symptoms. When we started to talk with them, do the medical visit, we found out they were pregnant. And their very first question was, where's the closest abortion clinic? And our staff got to sit with them, talk with them, point them towards truth, encourage them, remind them that we're not just there for the baby, we're there for the mom as well. And so that woman ended up choosing life, and our staff got to walk with her for the next 2 years. And She has since moved out of state, but we threw her a baby shower, got her connected with local members. And so, yes, that is happening day in, day out. We're not just giving her a pregnancy result and saying goodbye. We're ending up, walking with her through those decisions. And that's true for that woman. It's true for the refugee. It's true for anyone that comes through our doors. We have that opportunity.
Excellent. Christy Chermak, thank you so much for sharing with us about, again, Watermark Health. And we have all the links necessary to Watermark Health as well as Watermark Urgent Care. And it's just been great to have you on the program. And thank you for being such a dedicated disciple of Jesus Christ and making such a difference in our community. So thank you for joining us today here on Point of View.
Well, thank you. It's a pleasure and a privilege to get to serve Dallas, and our team loves doing it.
We are going to take a break, and when we come back, we're going to spend some time talking with our friend, Dr. Mark Hitchcock. Originally, our plan was just to spend some time talking about his new book, Showdown with Iran, Nuclear Iran and the Future of Israel, the Middle East, and the United States of America in Bible Prophecy. And that probably could have taken enough time, but then he just has a new book out called The Corona Crisis, Plagues, Pandemics, and the Coming Apocalypse. So we'll try to do a twofer here. We'll spend about half an hour on each one of those books. And then as we finish off that hour, then the next hour we'll spend some time talking with Rachel Gilson, Born Again This Way. And I think you will appreciate that conversation as well. And then we'll get back to some of the facts, figures, and statistics related to this pandemic. So we, as always, have lots to cover today. And so if you would like to know more about Christy or Watermark Health, you can go to the website. If you'd like to know more about these books by Dr. Mark Hitchcock, you can do so. And my Viewpoints commentary today is on the National Day of Prayer. And if you don't know some of the history and would like to maybe post that on your website and encourage people to be praying for this country, we encourage you to do so. It's all available at the website, pointofview.net. And I might also mention that we do have our Pray for America material. If you have not subscribed, that's on the right-hand side. And as you do that, you'll have some information. And as you go to our website today, you will notice that one of the articles we've posted is the time for us to pray together, and it's a piece that just is a reminder of the importance of praying any day, but especially during this National Day of Prayer. So if you want to have some resources, use them on your Facebook page, your Twitter page, send them to some people, send an email, maybe pass them on to your pastor. All of that material is available at our website, pointofview.net. We come back, we're going to spend some time talking about Bible prophecy with our good friend, Dr. Mark Hitchcock. All that coming up right after this.
Having civil conversations about important issues seems to be harder and harder. Various media outlets tell people what they should believe, why they should be outraged, and getting people to actually think, well, it can be difficult. Whether it's the gospel, tax issues, social policy, or just about anything else, you need to have solid information and clear thinking to address the hard issues. You need God's truth applied. And that's what you get in less than 2 minutes with Point of View's Viewpoints Commentary, a daily resource to help you be informed and think through the things we need to be talking about. It is free and will arrive in your inbox each day when you visit pointofview.net/signup. Sometimes we know we should say something, but we're silent because we're not quite sure what to say. Viewpoints Commentary can help you break the silence and change the narrative. It can make you a more equipped agent for truth. Get your free subscription to the Viewpoints Commentary at pointofview.net/signup. Pointofview.net/signup. Point of View will continue after this.
I just want to thank you so much for all the wonderful programming you have. You're just absolutely fantastic.
I recently started listening to Point of View, and I really found it interesting because of the different subjects you cover. Thank you for that.
I really appreciate everything that you do in keeping us informed.
Thank you, Kerby, for everything that you have been doing. I appreciate all the work that you're doing, advocating for the Word of God. Thank you so much.
Point of View, I think, is absolutely necessary because it's a Christian perspective, a biblical worldview perspective, and receive very current, up-to-date information about what is really going on, week to week in our culture, which is changing so rapidly, and yet it's morally sliding backwards.
Yeah, I'm just, first of all, I thank you guys. Y'all's program is wonderful, and enjoy it every day. I learn so much every time I listen to it.
Point of View Radio Talk Show.
Hi, this is Kerby Anderson. You know, each day we take on the tough issues and provide a biblical perspective to them. The topics we cover are wide-ranging. Apologetics, theology, prophecy, creation and evolution, intelligent design, marriage, family, child-rearing, the millennial generation, friends and society, politics, economics, business, religious liberty, the Constitution, public policy, foreign policy, military policy, tensions in the Middle East, abortion, homosexuality, pornography, sexual ethics, media, technology, history, and America's godly heritage. We talk about anything that affects your faith, your family, or your freedom. So don't go anywhere, because Point of View starts right now.
Across America, live. This is Point of View. And now, Kerby Anderson.
Thank you for joining us. It is Thursday, and it is our National Day of Prayer, so certainly encourage you to find some of the material that we have posted on our website, Pray for America, and even tonight there'll be an opportunity for you to watch a couple of different events taking place, and you can consult your various TV listings for some of those, one out of Washington, D.C. Also go to Facebook. I see some of the various events taking place, and even though we can't be in one of those 60,000 different sites that have always been a place for us to gather and pray, we can participate in the virtual events, so I encourage you to do so. And before the end of the next hour, we'll spend some time talking about where to find some of those resources. But I thought it would be interesting, especially today, to talk about some of the prophetic significance of a number of events. And we had scheduled originally that Dr. Mark Hitchcock would be with us as we talk about his new book published by Thomas Nelson, Showdown with Iran, Nuclear Iran and the Future of Israel, the Middle East, and the United States in Bible Prophecy. But then just about a day or two ago, arriving in my mailbox was the second book by Dr. Mark Hitchcock, Corona Crisis, Plagues, Pandemics, and the Coming Apocalypse, also published by Thomas Nelson. As far as I can tell, he finished writing it in April, and here it is May, and he's already got the book out. So that's pretty incredible there as well. So we really will try to cover two different issues, although, as you'll see, they're very interrelated. Dr. Mark Hitchcock has been on the program with us so many times before, author of more than 30 different books on Bible prophecy, an individual with not only his master's degree, but his doctorate from Dallas Theological Seminary, in addition to his law degree, I might mention, an associate professor at Dallas Seminary, and also senior pastor of Faith Bible Church. And Mark, it is always great to have you on the program with us.
Well, thanks for having me. It's great to be with you.
It is sad to not have you across the table, because we have some great conversations, not only on the air, but some great conversations off the air that are a lot of fun as well. But let's get into this, because as I oftentimes do, we're talking about Middle East prophecy. We're talking about foreign policy. And it is amazing how many times the nation of Iran surfaces. One, because for a while we had a nuclear deal with them, which has been changed. And you have a whole chapter talking about the dangers of what you call atomic Iran. And it is amazing to me that it doesn't take much in some respects for you to set the stage, because all you have to do is quote from a couple of headlines to simply say, Iran is in the news, and we need to know how that fits into Bible prophecy. Tell us more, if you might.
Well, that's right. I mean, anybody that watches the news at all, in fact, if you don't even watch it much, I mean, everybody knows that Iran right now is kind of the number one nation out there, really a supporter or sponsor of terror. Certainly they're causing problems constantly in the Persian Gulf. They're constantly, hitting bases where American troops are in Iraq. They're in Syria right now, right on Israel's northern border. They've kind of gone there to support Bashar al-Assad and his regime. So really they have their tentacles throughout the Middle East. And at the same time, they are trying to cross the nuclear finish line. Just a couple of weeks ago, they put their first military satellite into orbit. Now,
yes.
There's some disagreement about whether that was successful or not, but at least they tried it, and we know that for sure, whether it was successful or not. So they're doing all of these things. At the same time, they're trying to get a nuclear weapon. And, of course, you have to have something to deliver the nuclear weapon. So this missile technology and firing a satellite into space is certainly not a comforting thought for a nation that has their ideology and is trying to get a nuclear weapon.
And again, we've talked about in the past the attempt to try to prevent them from getting that with the centrifuges and everything like that. There was an attempt by the previous administration to come up with a deal which I wasn't sure was going to prevent them from doing so. So this is not just something which we in the United States should fear or Israel should fear, although Iran has made it very clear that they would love to destroy both Israel and the United States. Even the other nations surrounding Iran are certainly those who are fearful of what an atomic Iran might look like.
Well, that's right. And probably chief among them is Saudi Arabia. They have a great fear of Iran. A lot of people may not realize Iran is a Shiite or Shia Muslim, whereas Saudi Arabia and most of the other countries are Sunni Muslims. The only three that are majority Shiite are Iran, Iraq, and Bahrain. And, of course, Iran basically pretty much controls Iraq, at least the southern part of Iraq now. And they're also, Iran has real close affinity with the government in Syria as well. But, yeah, the other nations that are there, a lot of the Gulf states, certainly Saudi Arabia, they're definitely afraid of Iran, and they kind of rely upon the United States as kind of a buffer to keep Iran at bay. But, yeah, these other places, these other nations over there, they're in the crosshairs as well.
Well, one of the things you talk about is what you call the Persia prophecies, and that, of course, would be the book of Daniel as well as a little bit of Isaiah. And that also, in just a minute, we're going to get into the issue of Ezekiel, which we've talked about before in terms of this kind of end-time coalition. But what can we learn about Iran and this region of the world just looking at the book of Daniel?
Well, the book of Daniel has a lot of prophecies from the past that have come true. I always like to look at that because, you know, if we're going to believe prophecies in the future that are going to come to pass, it's always good to know that whoever we're listening to has made past prophecies that have come to pass.
Yes.
Because you can just say, well, hey, just trust me. But with the Bible has an incredible track record of telling the future and it coming to pass. And in the book of Daniel, in Daniel chapter 2, Daniel lays out these different empires that would come in a row, starting with Babylon and then Medo-Persia and then Greece. And that's exactly what happened. The Medo-Persian Empire overthrew the Babylonian Empire. Of the same thing in chapter 7 of the book of Daniel with a little bit different imagery. So you have these prophecies in the book of Daniel that prophesied the coming of the Persian Empire, the past Persian Empire. And, of course, we have, as you mentioned a minute ago, Ezekiel that prophesies a future coming of the Persian Empire, of what we call today Iran. But the fact that the Bible has been correct in predicting Iran or Persia's future in the past, we can know that it's accurate on what it tells us is going to happen. So I think it's important for us to see that connection. And again, let's take a break, and when we come back, I want to get into Ezekiel 38. But one of the things I thought was kind of interesting is, even as much as I've heard you speak on this issue and a variety of other individuals, you've got some great quotes from Ronald Reagan, which I did not know that he had made comments about the 38th chapter of Ezekiel and talked about some of these prophecies as well. So when we come back, we're going to try to make sense of this idea of Gog and Magog and Meshech and Tubal and Cush and Put and Gomer and Death to Garma, and a lot of these names that you go, okay, what are these? And again, one of the things that we so appreciate about Mark Hitchcock is being able to kind of unpack what that means and what this war that is talked about in Ezekiel chapter 38, how that kind of fits into what we're looking at right now. Then, of course, answering the question, well, where's America? I don't see that in any of these prophecies here, and how's that all fit together? And so we'll spend some time looking at that in terms of Iran. A little bit later, I want to get to his book on the Corona crisis. You know that when we talked with Joel Rosenberg a while back, he pointed out this idea of pandemics. We do see some examples of that in Matthew 24, and a lot of people have wondered, is the coronavirus a judgment of God? And all sorts of other really important questions, all of which are answered by Dr. Mark Hitchcock, and we'll continue with him right after this.
This is Viewpoints with Kerby Anderson.
Today is the National Day of Prayer. It is a vital part of our American heritage. The first call to prayer happened before the American Revolution. In 1775, the Continental Congress called on the colonists to pray for wisdom as they considered how they would respond to the King of England. Perhaps one of the most powerful calls to prayer came from President Abraham Lincoln during the Civil War. In 1863, he issued a proclamation for a day of humiliation, fasting, and prayer. Here is some of that proclamation. He said, "We have been the recipients of the choicest bounties of heaven. We have been preserved these many years. In peace and prosperity, we have grown in numbers, wealth, and power, as no other nation has ever grown. But we have forgotten God. We have forgotten the gracious hand which preserved us in peace and multiplied and enriched and strengthened us. We have vainly imagined in the deceitfulness of our hearts that all these blessings were produced by some superior wisdom and virtue of our own. Intoxicated with unbroken success, we have become too self-sufficient to feel the necessity of redeeming and preserving grace, too proud to pray to the God that made us." In 1952, Congress passed and President Harry Truman signed a resolution declaring an annual National Day of Prayer. In 1988, President Reagan signed into law a bill that designated the first Thursday of May as the time for a National Day of Prayer. It is estimated that there have been more than 130 national calls to prayer, humiliation, fasting, and thanksgiving by presidents of the United States. There have been 60 presidential proclamations for a National Day of Prayer because every president has signed these proclamations. Today is the National Day of Prayer. Please pray for this nation and its leaders. I'm Kerby Anderson, and that's my point of view.
For a free copy of Kerby's booklet, A Biblical View on Socialism, go to viewpoints.info/socialism. That's viewpoints.info/socialism.
You're listening to Point of View, your listener-supported source for truth.
Privileged to have with us today Dr. Mark Hitchcock, again, professor at Dallas Theological Seminary, as well as senior pastor at Faith Bible Church, and his book is entitled Showdown with Iran, Nuclear Iran, and the Future of Israel, the Middle East, and the United States in Bible Prophecy. It is published by Thomas Nelson, and we have an opportunity for you to get a copy of it both in paperback and Kindle. I suspect you might also find it in your local bookstore, but a lot of us aren't making our way to bookstores, and we've just made it very easy for you to get it online as well. Well, Mark, let's, if we can, talk about Ezekiel 38. Anybody that opens it up says, these names don't make a lot of sense to me. And one of the things you're very good at is helping us understand kind of the historical evidence of what these nations are. But this is an aligning of nations against Israel. And boy, we could certainly see that happening in the future, can't we?
Sure. And we kind of see really the foreshadows of it now as, certainly Israel's always, they're surrounded by enemies. They're kind of always being threatened. And, the Bible predicts in Ezekiel 38, this coalition of nations is going to come down into Israel in the end times, in the latter years, it says. And, of course, Ezekiel 37 is the great chapter about the dry bones. It's the regathering of the nation of Israel to their land, which has been going on now in modern times since 1948. So that precondition's been met. And they list these names here. There's 10 names that are listed, or proper names, in Ezekiel 38, 1 through 7. Gog, I think, is the leader of this invasion. He's referred to and kind of in the as a person. God addresses Gog personally. So, and the word Gog, we're not really sure what it means. It may mean high or lifted up, or maybe mountain. Some think it means darkness. Again, that's basically a picture of what this leader of this invasion will be like. And then just kind of go through the rest of these pretty quickly. Rosh, I think, is Russia. It's not just because they sound alike, but there was a group of people in Ezekiel's day who lived in the area of southern Russia today that were called the Rasapu people. Now, these names are like Meshech and Tubal and Togarmah and Gomer. Obviously, we don't find those anywhere on a map today. What I think we want to do is find the modern counterparts of these places that Ezekiel mentioned. So when we look at Magog, that's Central Asia today, basically, Afghanistan, the underbelly of the old Soviet Union, like Kazakhstan and Tajikistan and those nations. Meshech and Tubal are in modern-day Turkey, as are Gomer and Togarmah. And then we have Persia mentioned, which Persia became Iran in 1935, and in the late 70s became the Islamic Republic of Iran. And then we have Ethiopia mentioned, which literally in the Hebrew there is actually Cush, which is Sudan, which is a radical Islamic nation. And then Put is also mentioned, which is modern-day Libya. So these are all nations that exist today. They all really have a desire to destroy Israel. They're forming alliances with one another. And so it's not very far-fetched. It doesn't take a great imagination to imagine these nations coming together at some point to come against Israel. And as I mentioned earlier, Russia and Iran are both in Syria. They have troops and weapons there right on Israel's northern border.
Yes.
Which is a really amazing development here in the last few years.
I might just mention, too, you also go into why, and, of course, first of all, the wealth of Israel. Also, just it's a strategic point. One of the reasons that Israel was attacked so many times is if you look on a map, Israel is in this very key location, both in the ancient world and in the modern world. And, of course, you also suggest that, some of that might have even happened before the tribulation, and they may have an antichrist or something like that, but it then describes all sorts of things, a battle, earthquake, diseases, a variety of other things happening simultaneously. And for anybody that looks at that and said, oh, that happened in the past, no, it didn't. I mean, this is all going to happen sometime in the future, right?
Well, it is. And even in Ezekiel 38, it tells us that this is going to happen in the latter years. It's going to happen in the last days. And it's talking about the latter years of the last days of Israel's history. And again, like you've said, you read through this chapter, unless you just use some kind of wild method of Bible interpretation, nothing like this has ever happened before. You've never had Israel regathered in their land. It says they're going to be living rest and securely. And all these nations, particular nations, coming against Israel, and then they're supernaturally wiped out and destroyed by God. So it's never happened in the past. When we do see the ingredients of it, I believe, coming together today, and it could be an event that happens in the not-too-distant future. So, and this is a great polemic or a great apologetic, too, for the proof of the inspiration of the Bible. Over 2,500 years ago, Ezekiel wrote this, and yet it reads like today's headline. So it's a powerful apologetic, really, that the Bible's true and that what God says will come to pass.
And some of this didn't even make sense a few decades ago. Since I'm one of the oldest ones around the table here, I can say, just even thinking through some of this and the relationship between Russia and Iran, that didn't make any sense, but it does now. But just before we take a break, I certainly want to address one issue that you've written an entire book about, Is America in Bible Prophecy? That book came out years ago. But you have chapter 8 that talks about will America survive? And you give us a couple of reasons why, even as you're reading this prophecy, there's nothing about the United States of America. Can you explain possibly why?
Well, yes. Everybody agrees that the words America or United States never occur in the Bible, but a lot of people try to find America in some maybe symbolic references like America's Babylon in Revelation 17 and 18, or America's the 10 lost tribes of Israel, or the unnamed nation in Isaiah 18. There's a lot of places people try to find America, but I don't think America is mentioned in prophecy, which that raises the issue, well, why not? And if we are the world's greatest economic, political, military power as we are today, it would be unusual for us not to be mentioned somewhere in the end times. So my conclusion, and many others have concluded, that America, something's going to have to happen to America, that we're not going to be the great superpower we are today. And there's a lot of different plausible scenarios of what could happen. Certainly economic implosion. The way we're spending money now and this, COVID-19 is just unbelievable.
Yes.
A moral cave-in, a nuclear 9/11. One interesting theory out there, and I wrote about it quite a bit in the book, is a civil war.
Yes.
It's polarized.
I saw that.
The country is.
Yeah.
These are a lot of really credible people have have wondered about that. So this isn't some, just idea that kind of fringe people have. But we don't know for sure. But my view is that it's going to be the rapture. That one of these days, in the twinkling of an eye, the Lord Jesus is going to come and rapture his church, take his bride out of this earth. And you talk about in America, a drop on the Dow Jones the next day, or unpaid mortgages. I mean, it's going to devastate our country. And so I think it very well could be that the rapture of the church could be the judgment of God on America, kind of the reduction of America. And just think about that could also happen in a deadly combination with some of these other things as well. And so it could be that that's the event that causes America to not be the superpower we are today, and why we're not mentioned anywhere in biblical prophecy. I think that's a pretty plausible explanation.
I would agree. And let me just mention that we're going to take a break, and then we'll come back and talk about the Corona crisis. This book, Showdown with Iran, there's 180 pages. Obviously, we haven't even covered all of the material, and this is why I would encourage you to get a copy of the book. You can go to markhitchcock.com and find information that you want right there. I think it's marklhitchcock.com, but we have the link, so you certainly can follow it there. Many of his sermons, some of his videos, and this book, which, again, if you wanted to get from him, you're free to do so. We've also provided a link to both the paperback and Kindle. 9 different chapters, 3 appendices, one on the prophecies in light of Iran, and then also Iran's presence in Syria and the destruction to Damascus, how that relates maybe to Isaiah 17, and, of course, the whole issue that we've been talking about, Ezekiel 38 and 39. So just some great material that is available, and so the book is out, and it's one that I think you would certainly want to get a copy of. And it has this copyright this year. But again, you talk about a book hot off the press. When we come back from the break, we're going to talk about the Corona crisis. And we've talked a little bit about this idea that plagues are described in the scriptures. And, of course, you have a King James Bible. You also have the words pestilence showing up in things like Matthew 24. And so we're going to talk about the Corona crisis, plagues, pandemics, and the coming apocalypse. This is just hot off the press. I doubt you'll be able to find it in your local bookstore, but it'll show up soon. And so, again, if you wanted to know more about that particular book, we also have a link to it on the website as well. So take the time to go to the website for Mark Hitchcock, and you can find all sorts of books by him. He has, of course, the End Time Survival Guide, and we'll talk a little bit about how we can even survive and how we can even react to some of the things that are happening around us. And so those all are available on the website, pointofview.net. Also, let me just mention that this is, of course, our National Day of Prayer. So we have my commentary today on this National Day of Prayer. We also have the Pray for America event, and also you can click on that button that says subscribe and receive some of the updates we give to you on a regular basis, because as you probably hear us talking about today, we certainly do need to pray not only for our leaders in this country, but for leaders around the world, and pray about the times in which we find ourselves in. So when we come back, we'll talk about the Corona crisis, all that coming up right after this.
"2020. Is there anything important happening this year? Well, not unless you consider major disputes in various Christian denominations, international tensions over a flu epidemic, economic uncertainties, and a presidential election important. Question: where will you get real news, credible opinion, clear biblical thinking on the things that matter most? Answer: Point of View Radio with Kerby Anderson and the team. You can make sure their voices continue speaking loud and clear by taking a moment right now and joining the Truth Team. It's easy, but you do have to visit our website or make a quick call. Go to pointofview.net/team or call 800-347-5151. You have the power to make a difference. Joining the Truth Team can help ensure that millions of people will get a different opinion from the major purveyors of fake news. We don't get big advertising dollars like the networks or tax money like PBS. We depend on you. Pointofview.net/team and 800-347-5151. Point of View will continue after this.
are listening to Point of View. The opinions expressed on Point of View do not necessarily reflect the views of the management or staff of this station. And now, here again is Kerby Anderson.
Continue our conversation today with Dr. Mark Hitchcock. And what I have in my hands here is kind of an advanced copy of The Corona Crisis, Plagues, Pandemics, and the Coming Apocalypse. Its actual publication date is later this month. I think it's May 19th, but I have an advanced copy. And if you would like to get a copy, you can pre-order it. We have information about that on our website, pointofview.net. And Mark, we had, I think, our third trip for a lot of our Point of View listeners to Israel back in October. Went to Israel and Rome. And then as the pandemic unfolded, we said, aren't we glad we didn't have a tour in March, which is what you and your wife Cheryl had. You arrive in Tel Aviv. Actually, you left Edmond, Oklahoma on February 29th, arrive in March. And as I understand it, I think you were one of the last of the tour groups to leave Israel. And as you said, when you came back to the United States of America, you had almost like returned to a different country, didn't you?
Well, yeah, it was amazing because you know how it is when you're in Israel. You're kind of insulated. You're kind of in a bubble over there traveling with your group. And of course, we'd watch the news at night and knew what was happening back here. And we're getting a lot of texts and emails from folks. But yeah, when we got back to the States, when we left in 2 weeks' time, it's like we came back to another world. And we've all kind of run out of adjectives. We've used the word surreal and unprecedented and strange and all those words. Probably we've worn those out, but that's what it was when we came back. It was so different, and that's basically what we've been living with ever since then. So we went to Israel. Things were kind of normal. We came back, and ever since then, it's been like it is now.
As somebody that has published books, just the fact that you have a statement here, April 2020, and here it is, the first part of May, and this book's in my hands, is amazing to me. So kudos to you and to the publishers. But let's talk about how to make sense of these signs, because you spend some time saying, look, we want to look at this in a serious way, not a sensational way. We want to apply Scripture, not try to just read Scripture into the headlines. And so in some respects, again, one of the things I appreciate about you is the kind of common sense, biblically integrated kind of view that we're going to use now as we try to make sense out of this coronavirus, and even how this might in some way be a foreshadowing of something that might happen during the tribulation.
Well, that's right. We want to always remember some important principles. We don't want to look at the Bible through the lens of the headlines. We want to do it the other way around. We want to look at what's happening in the world through the lens of the Bible. So we start with the Bible, and then we look at things that are happening in the world. And I think that helps us avoid misinterpreting things and just kind of a sensationalistic view that just takes every event as some, great sign. I always like to say, if everything's a sign, then nothing's a sign. And I think that's the way a lot of people are, just kind of everything out there, some sign that's taking place at the end times. But so we want to be serious about this and not sensational. Look at Scripture first, not just the headlines. And we want to remember, and this is, again, part of my grid of looking at things, I believe the signs that are given to us in the Bible are of the second coming of Christ, not the rapture.
Yes.
I see the second coming and the rapture, I call it the rapture and the return, as two phases of the second coming of Christ. Just like Jesus' first coming, and we had his birth, his life, his death, his resurrection 3 days later, then his ascension 40 days after that. Those were phases of his first coming. The second coming is going to happen in two phases as well. And so these signs are for the second coming, not the rapture. I think the rapture is a signless event that can happen at any moment. But I always like to say, if we can already see the signs of the return and the rapture hasn't even happened yet, then that means the rapture must be pretty close.
I would think so.
I think that's the way that kind of works. It's kind of a prophetic overlap.
It is.
That's part of the way I look at these signs. And
again, I'm going to move through this fairly quickly because, if nothing else, you've got such great material. But when we talk about plagues, a word like plague ends up, of course, in the Bible. The word pandemic does not. And, of course, I talked about pestilence in just a minute. But we do have quite a number of examples of plagues in the past that have taken place. Then we have plagues that have taken place during this church age. And then we have in the book of Revelation plagues in the future. Help us put that in context.
Well, that's right. And there's been plagues in the past. And, of course, we have to make it clear not every plague or pestilence that comes along is the judgment of God. God is sending in a judgment. We live in a fallen world. This is a groaning creation. But there have been plagues in the past that were directly sent by God. The plagues on Egypt, the plagues on the Philistines when they had the Ark of the Covenant, even plagues on God's own people when they broke covenant with him. And sometimes it will tell us in the Bible this was from God. And we know in the book of Revelation, chapter 6 and verse 8, there's going to be plagues and pestilence in the end times that God is going to send. And what we see happening today, I think, with this coronavirus, this crisis that we see happening, I don't see as a fulfillment of any particular prophecy, but I believe it's a frightening foreshadow of what's going to come in the future. And it's at a minimum, I think we could say that this is a massive wake-up call. It's kind of God's megaphone to our world for people to realize how frail and how fleeting life is, and that they need to turn to Jesus Christ for salvation before it's too late.
And I certainly think that is the case. And again, as you were asking the question, is the coronavirus a judgment of God? Not in the direct sense, although we do have examples, but in the broadest sense, in Romans chapter 8, it talks about the creation groaning in travail, or in the pains of childbirth, whatever translation you might have. So we recognize, because we live in a fallen world, we have earthquakes, we have tornadoes, and we have plagues and pandemics and those kinds of things. So it fits very well. But help us understand this idea of pestilence. Now, some of our listeners that maybe don't have a King James Bible have not seen the word pestilence, but nevertheless, that is something that goes back to what Jesus warned about in Matthew 24.
That's right. In Matthew 24, Jesus talks about a lot of different signs, but one of them, there'll be famines, pestilences, and earthquakes in various places. Basically, a pestilence is the same thing as a plague. It's disease that spreads rapidly, obviously, and kills many people. And the words plagues and pestilence are actually found many, many times throughout Scripture. But this is a place where Jesus is predicting the signs that will portend his coming. The disciples had asked him, what's going to be the sign of your coming, the end of the age? And he begins to lay these out. And one of them is there's going to be pestilence or plagues in various places. And so, it's caused a lot of people to wonder, what we're seeing today, kind of the first great plague of the 21st century, could this be, one of these birth pangs or one of these signs that Jesus mentioned?
And again, one of the things that you do is help us understand that what Jesus is saying in Matthew chapter 24 parallels very well with what we see primarily in Revelation 6 and a little bit in Revelation 7. And I think it's a great chart. Sometimes people that have heard me speak say, well, it wouldn't be a good Kerby Anderson talk without a chart. Well, probably that's true for Mark Hitchcock, too, because it shows a one-to-one comparison between Jesus talking about false Christ and the rider on the white horse, or famines and plagues and the rider on the pale horse. And so in some respects, when people in the book of Revelation see these riders on a white, a red, a black, or a pale horse, or hear about martyrs or something else, they really need to go back and connect up what they see in Revelation chapter 6 to what Jesus talks about in Matthew 24.
That's right. They're parallel. And so what happens with a lot of people, I think, is they read Revelation 6 and they put that in the tribulation, I think rightly so. Those are the beginning of the opening of the seven seals, of the seven-sealed scroll, and that's the beginning of the tribulation. But then they go back to Matthew 24, and where we have the same parallel signs mentioned. In fact, Matthew 24 is often called the mini-apocalypse, kind of the Reader's Digest or summary version of the book of Revelation. And they go back in Matthew 24, where those are called birth pains or contractions, and they see those as being fulfilled today. But I think since they're parallel, wherever we put Matthew or Revelation 6, we have to put Matthew 24. I think they're both future. They're both talking about what's going to happen in that condensed period of time of the tribulation that will immediately precede the second coming of Jesus. So in that sense, I don't see the coronavirus as a direct fulfillment of those prophecies or those birth pains. But like I think it's John MacArthur points out, these might be like the Braxton Hicks contraction, kind of like the premature birth pains, if you will.
Very
We're
good.
seeing because so many things are happening, with Israel's in the land. And also with this coronavirus, it's exposing and accelerating the globalism in our world.
Mm-hmm.
And the need to control people's lives and know where people have been and, to track and trace people on their phones, to find out where they've been so we can find out if they're spreading the virus. So all of this is fitting together as a foreshadow and a setting of the stage, I believe, for the events that are predicted in the Bible for the end times.
Excellent. Let's take a break, and we'll continue for just a few more minutes with Dr. Mark Hitchcock. This book is just coming out, and you get a kind of advanced look at the corona crisis, plagues, pandemics, and the coming apocalypse. We'll talk about some of those thundering hoofbeats in just a minute, and then how to survive the stampede. And if you go to Mark Hitchcock's website, you'll also see that he has the End Time Survival Guide, just giving you some ideas on how to survive in a time of fear and concern. And we'll talk more about that with him right after these important messages.
Now, back to Point of View, your listener-supported source for truth.
Back for a few more minutes, and we are privileged to have with us just for a little bit longer Dr. Mark Hitchcock. Again, the book is entitled Corona Crisis, Plagues, Pandemics, and the Coming Apocalypse. Just coming out shortly, and if you'd like to do an advanced ordering of it, you can do so. And Mark, you have a chapter here on the thundering hoofbeats of the Pale Rider, and if you think about this, some of those issues that seemed almost unthinkable, for a while there was this confidence that, we're going to eventually get rid of hunger and famine, get rid of extreme poverty. We certainly have not been hit by any kind of major plague, and when we had the Ebola plague, we were able to knock it down pretty quickly. just over the last couple of months, that has sort of rattled everybody's cage, and it's a reminder that, Paul tells us not to be anxious about anything, but with prayer and supplication, thanksgiving, let your requests be known to God. So we really need to cast our anxieties on him. As Peter says, we should not be having a spirit of fear, but at the same time, you can begin to see some things which almost seemed unthinkable this time last year becoming a lot more plausible right now when we start talking about the various hoofbeats of some of those writers that are described in the book of Revelation.
Well, that's true. We kind of the illusion of control, I think, that a lot of us have had is gone. And we don't really ever have control, but I think when things are going good, we have this illusion of it. And, things have changed overnight. That's why, to me, it seems like this coronavirus is kind of almost like a prophetic shift of gears. It just shows how quickly everything can change. In a matter of, a couple of weeks' time, the whole world changed. I think it's showing us today how that can happen. And when you get to Revelation chapter 6, which is, I believe, the beginning of a future time called the tribulation period, it's going to begin after the rapture occurs. We see these four horsemen ride forth, and the first one's a rider on a white horse who's a false Messiah, it's the false Christ who's going to come, the Antichrist. And again, the world's paved right now, I think, and ready for someone like that who's going to come and take control. People are already looking more to globalism and global government to somehow come in and rescue us from these kinds of crises. So we see that, the world's ready for a man with a plan. The second thing is war, the rider on the red horse. Again, we see just the world in turmoil today. Then following that is famine. And certainly after war, something that often comes about is famine. And we look at our world today, and there's concerns right now, even just about maybe food shortages.
Yes.
But then we come to the fourth of these riders, the pale rider, and the pale rider, it says, and this is a staggering thought: a fourth of the world is going to die, just in that one judgment in the future.
Wow.
That's just one of those mind-numbing statistics. That it says they're going to be killed by four means: sword, famine, which kind of harks back to the second and third horsemen. But then it says pestilence. There's that word again.
Yes.
And literally the word there in the Greek is just the word death, but in the context it means plagues. And then it says, and this is really kind of cryptic, and by the wild beasts of the earth. Now, I don't think the wild beasts or animals are going to become so unrestrained that they're going to be the great source of killing people. And when you look back in history, the greatest source of death is infectious disease in the world. And one of the greatest sources of infectious disease are animals. And it's amazing, as I did study about this, 3 out of every 4 new infectious diseases that rise now come from animals.
Wow.
And it's called a spillover, where it's transmitted from animals to human beings. And we've had 30 new infectious diseases in the last 30 years. So they're happening about 1 a year. And most of them are coming from animals. And I think that's the tie there. It's sword, famine, pestilence or plagues, and the wild beasts of the earth.
Yeah.
And so what we're seeing here with this is, again, these viruses, there's no cure, there's no vaccine for them. They're erupting in various places all over the world. And to me, that's a real foreshadow of what's going to ultimately happen during the tribulation period, and even a greater way. So, this coronavirus, it's a wake-up call. It's a foreshadow. It's a setup, if you will, for what's coming.
And again, you have a whole list here, from mosquitoes, from ticks, from bats, from birds, from pigs, all sorts of other ones. Again, Centers for Disease Control talks about that. And in the time remaining, some people say, well, what do we do? And I'd always like to say, well, 2 P's. Keep praying and keep proclaiming the gospel. And in some respects, I would also point people to your book, The End Time Survival Guide. So talk about, in the last few minutes that we have together, how do we respond to all of this?
Well, I've got those same 2 P's actually in my chapter here. I've got a chapter near the end of the book called Surviving a Stampede.
Yes.
And, the first thing that we need to be doing is we need to have perspective. I love a statement I read years ago: heaven has an occupied throne. And we need to keep the perspective that God's on his throne in heaven. And, it's been well said, there's no panic in heaven, only plans. The Trinity never meets an emergency session. God has it under control. And so, we need perspective, and we need to pray. I think God's probably been hearing from a lot of people here recently. Maybe he hasn't heard from in a while, as people are kind of panicking. But we need to turn our problems and our panic into prayers and seek God. Another thing that we need to do is we need to be practical. Again, we need to wash our hands and, love our neighbors by not getting too close to people and things like that. I mean, just take practical steps. And I have some really good quotes in the book from Martin Luther and others back when they faced plagues, the bubonic plague in their day and the things they did. But then the fourth thing is another P you mentioned, is proclaim. I think there's a lot more openness to the gospel now than there's been maybe at any time that I remember in my lifetime. People feel shaken. They're looking for something solid, and the Bible tells us that we have a kingdom that can't be shaken. And we have a rock of ages, a refuge, a sanctuary to offer to people through Jesus Christ. And so I think we need a renewed sense of urgency in our evangelism as we're ambassadors for Jesus. And we need to take these opportunities that God gives to us, I think, in this time, because, again, when this goes away at some point in time, the window may close quickly. And so we need to seize this opportunity to be faithful witnesses for Jesus Christ in this generation.
I just mentioned, too, that chapter 8 ends with a universal virus and its cure. Of course, that is sin. And so this is such a good book that, first of all, any Christian reading through this is going to say, well, I hadn't even thought about that with the wild animals and all the lists that you have there, and famine and pestilence and those kinds of things. But you could hand this to your non-Christian friends who'd be reading through it going, well, wow, this is really something. And then comes to the last part, which really talks about how sin has affected the world and how in a very significant way this can be an evangelistic opportunity. So, Mark, as always, such great books, and I'm thrilled that I got an advanced copy of this one, and I know many of our listeners are going to want to pre-order it because it's coming out shortly. And as we've mentioned before, we have a link to your website so you can find out some more about Russia Rising, for example, the End Time Survival Guide, and so many books. And eventually we'll come out of lockdown, and some people might want to even have you come and speak at their church or at their prophecy conference. So it's all available at our website, pointofview.net. So it has always been great to be with you. I've enjoyed sharing the stage with you and getting to know you and your wife, Cheryl, and say hi to all the people up there in your church, and I look forward to the next opportunity.
Well, thank you so much. God bless you, and I always enjoy the fellowship with you very much. And I pray the Lord will continue to bless your ministry.
Well, again, let's hope we can be face-to-face next time because we always enjoy the conversations. But again, real quickly, if you just joined us, we talked in the first half hour, Showdown with Iran. That book is out, and just a fascinating book and just great material. But then one that is coming out shortly, Corona Crisis, Plagues, Pandemics, and the Coming Apocalypse. And it's all available at our website, pointofview.net. You may be able to find them in your local bookstore, but I know sometimes those are hard to find, and especially since one of the books is not out yet. I've got the advanced copy here, but soon you'll be able to have it in your hands and get it on Kindle or paperback, so take the time to visit the link that we've provided there. It's National Day of Prayer. Please be in prayer. If nothing else, this should really cause you to want to pray for this nation, pray for our leaders, and pray for the situation we find ourselves in right now. And what an evangelistic opportunity. So use some of these books, perhaps, to talk to your friends, neighbors, coworkers, even family members about the gospel. So let's take a break. When we come back, Rachel Gilson will be with us as we talk about her book, Born Again This Way. I think you'll find that fascinating. Then we'll get back into some of the issues of the pandemic. All that coming up right after this.
Having civil conversations about important issues seems to be harder and harder. Various media outlets tell people what they should believe, why they should be outraged, and getting people to actually think, well, it can be difficult. Whether it's the gospel, tax issues, social policy, or just about anything else, you need to have solid information and clear thinking to address the hard issues. You need God's truth applied. And that's what you get in less than 2 minutes with Point of View's Viewpoints Commentary, a daily resource to help you be informed and think through the things we need to be talking about. It is free and will arrive in your inbox each day when you visit pointofview.net/sign-up. Sometimes we know we should say something, but we're silent because we're not quite sure what to say. Viewpoints Commentary can help you break the silence and change the narrative. It can make you a more equipped agent for truth. Get your free subscription to the Viewpoints Commentary at pointofview.net/sign-up. pointofview.net/sign-up. Point of View will continue after this.
I just want to thank you so much for all the wonderful programming you have. You're just absolutely fantastic.
I recently started listening to Point of View, and I really found it interesting because of the different subjects you cover. Thank you for that.
I really appreciate everything that you do in keeping us informed.
Thank you, Kerby, for everything that you have been doing. I appreciate all the work that you're doing, advocating for the Word of God. Thank you so much.
Point of view, I think, is absolutely necessary because it's a Christian perspective, a biblical worldview perspective, and receive very current, up-to-date information about what is really going on, week to week in our culture, which is changing so rapidly, and yet it's morally sliding backwards.
Yeah, I'm just, first of all, I thank you guys. Y'all's program is wonderful, and enjoy it every day. I learn so much every time I listen to it.
Point of View Radio Talk Show.
Hi, this is Kerby Anderson. Each day we take on the tough issues and provide a biblical perspective to them. The topics we cover are wide-ranging. Apologetics, theology, prophecy, creation and evolution, intelligent design, marriage, family, child-rearing, the millennial generation, friends and society, politics, economics, business, religious liberty, the Constitution, public policy, foreign policy, military policy, tensions in the Middle East, abortion, homosexuality, pornography, sexual ethics, media, technology, history, and America's godly heritage. We talk about anything that affects your faith, your family, or your freedom. So don't go anywhere, because Point of View continues right now.
Across America, live. This is Point of View. And now, Kerby Anderson.
Thank you for joining us. This hour we're going to spend some time, first of all, talking about this new book, Born Again This Way. It is a topic that we've addressed before, same-sex attraction. It might be helpful as you're ministering to other individuals. Perhaps it is something you are dealing with as well. I think you're going to appreciate that perspective, so I'll spend about half an hour on that. Then we'll get back into some of the facts and figures and statistics about the pandemic and where we are in terms of the lockdown and much, much more. So we have a lot to cover this hour. And if you find yourself wanting to know a little bit more about the previous conversation we had with Mark Hitchcock, we have that information. And of course, now we also bring a guest to the studio, or actually by phone, I should say, who will be addressing this issue, Rachel Gilson. And if you'd like to know more about her or this book, which is just out, we certainly encourage you to find that as well. Don't forget, this is the National Day of Prayer. We will have a few more things to say about that later this hour. And my commentary today is on the National Day of Prayer. And if you go to the right-hand side, we have a section where you can subscribe to the Pray for America material that we send out from time to time. So all of that will be something we'll talk about later this hour. But Rachel Gilson, as I mentioned, serves on the leadership team of Theological Development and Culture with Cru, formerly known as Campus Crusade for Christ. Her writings have appeared in Christianity Today and for Desiring God and the Gospel Coalition. Holds a Master of Divinity from Gordon Conwell Theological Seminary, lives in the Boston area. And Rachel, thank you so very much for joining us today, and thank you for writing this book.
Well, it's my pleasure to have written and to be with you.
Let's, if we can, maybe tell your story, because really a good portion of the book is your story. And then I think fits very well with the fact that it's entitled Born Again This Way, Coming Out, Coming to Faith, and What Comes Next. But tell us a little bit of your story, because, first of all, becoming a Christian changed some things, but not everything. So explain that maybe, if you could.
That's right. That's a good way to put it. Yeah, I grew up in a very non-Christian household, and by the time I was a high schooler, I was both very committed to atheism, and I also had realized that my sexuality felt more at home with other young women as opposed to young men. And, because I didn't have a moral background that really gave me any data as to why I shouldn't pursue romantic relationships with other women, I decided, well, this is really what I feel and what I want, and so I just went for it. This was around the turn of the century. I like to joke back when Will and Grace was still edgy and not nostalgic. So kind of a different time than we're in right now. And then I went off to school on the East Coast. I went to Yale University, which was a great experience for me. And it was during there, I thought, I'm finally going to be at this wonderful university where I'm going to explore big ideas, where I'm going to explore my sexuality, and it's going to be the starting gate of my life. And, oddly enough, it was, but for an entirely different reason than I thought, because God himself actually interrupted me while I was studying there my freshman year. On the one hand, I said, gosh, I'm not actually the smartest person who's ever existed in the world.
Yeah, I loved how you said that. Having gone to Yale myself, you can relate to that, because people say, you're really smart. It's like, you haven't been around some of the people I've been around. But anyway, go ahead. Yeah.
Wait, did you go to Yale?
I did graduate school, though. Yeah, different.
Oh, yeah. That's wonderful. Oh, that's great. So New Haven. I lived there for 12 years, actually. So right? Lots of people there, and I was like, oh, gosh, these are some world-class people. And at the same time, I also, experienced a breakup with my girlfriend at the time. And, teenage breakups, they're very dramatic. And so suddenly I kind of didn't really know who I was anymore without this girl, without my sense of my own intellectual superiority. And it wasn't like, I need to turn to Jesus, because I didn't believe in Jesus. But in that spot, the Lord found me. So I happened to be in a lecture one day. We were covering Western philosophy, and we were talking about René Descartes and how he, developed that phrase, I think, therefore I am, and develops from that a proof for the existence of God. I remember sitting in the audience thinking, well, that's a really stupid proof for the existence of God. And I still don't actually feel fully persuaded by his direction. But, I sat there and I thought, well, what if there are some good proofs for the existence of God? And, I was like, oh, no, we don't think that way. That's for stupid bigots. But I couldn't quite get it. So I'm a good millennial. So I decided to ask the internet, and so I would go to my room and just type in random religious search terms, seeing what would come up. And I kept coming back again and again to reading about Jesus. And I kind of had a caricature in my mind of who Jesus was. But as I was reading about him, I was really moved by, actually, he seemed very intelligent and very tender. And I thought, well, he'd be in the person of Jesus. I want to be a woman someday. Like this, it's just, those things don't go together. But the only two people I knew at Yale who identified as Christians were these two girls who were dating each other. And one of them was training to be a Lutheran minister. So I thought, well, maybe I should chat with those girls. And they explained to me very kindly, oh, yeah, this has all been a big misunderstanding. The Bible actually supports monogamous same-sex relationships. And I thought, well, that's news to me. So they gave me a packet of information, explaining entirely how it had all been basically a big misunderstanding. And so when I took that packet back to my room, I was ripping through it and thinking, gosh, this seems really persuasive. Like maybe there's really something to this. Maybe God's not against this after all. But I thought maybe I should check it against the actual text of the Bible. Since I didn't own a Bible, I was just pulling up the verses on the computer that they were claiming to interpret. And as I looked back and forth from, my computer screen to the packet they'd given me, I thought, oh gosh, this doesn't actually seem to be a very good interpretation at all. And it's not like at that point in my life I wasn't a Bible scholar. It's just the only things I'm good at are reading and writing. And so I thought, oh, I don't think they quite have the market on what this ancient document was trying to say.
Yeah, well, the logic wasn't working there. And then I think you ran across a book that was instrumental in my conversion, C.S. Lewis's book, Mere Christianity.
Oh, what another delightful thing to have in common. Yes, so I happened to be in the room of a friend, and she was getting something out of her room, and I was looking at her bookshelf, because I love to look at other people's bookshelves, and Mere Christianity by C.S. Lewis was right there on the shelf. And I thought, gosh, I've never heard of that book, but the title makes me want to read it. But I was too embarrassed to ask my friend for it, so I just decided to steal it. When you don't have much of a moral compass, it doesn't take much to get there. So I just grabbed the book and put it into my bag. And I happened to be reading it between classes one day. Soon after that, it was easier than my homework. And while I was reading it, I was suddenly overwhelmed, not only that there was a God in like a generic store brand kind of way, but that the God who made me existed, that the God who was holy existed. And honestly, I felt afraid. I knew that I was sexually immoral. I knew that I was a liar, that I was arrogant, that I cheated on things. I was reading a stolen book. All of the chips were in the guilty category. But I also realized with that part of the reason Jesus had come was to place himself as a barrier between God's wrath and me, and that the only way to be safe was to run towards him, not away from him.
Very good. Let me take a break, and when we come back, we'll talk a little bit more about that, because your conversion, and then not everything changed. So we'll talk about that right after these important messages.
This is Viewpoints with Kerby Anderson.
Today is the National Day of Prayer. It is a vital part of our American heritage. The first call to prayer happened before the American Revolution. In 1775, the Continental Congress called on the colonists to pray for wisdom as they considered how they would respond to the King of England. Perhaps one of the most powerful calls to prayer came from President Abraham Lincoln during the Civil War. In 1863, he issued a proclamation for a day of humiliation, fasting, and prayer. Here is some of that proclamation. He said, "We have been the recipients of the choicest bounties of heaven. We have been preserved these many years. In peace and prosperity, we have grown in numbers, wealth, and power, as no other nation has ever grown. But we have forgotten God. We have forgotten the gracious hand which preserved us in peace and multiplied and enriched and strengthened us. We have vainly imagined in the deceitfulness of our hearts that all these blessings were produced by some superior wisdom and virtue of our own. Intoxicated with unbroken success, we have become too self-sufficient to feel the necessity of redeeming and preserving grace, too proud to pray to the God that made us." In 1952, Congress passed and President Harry Truman signed a resolution declaring an annual National Day of Prayer. In 1988, President Reagan signed into law a bill that designated the first Thursday of May at the time for a National Day of Prayer. It is estimated that there have been more than 130 national calls to prayer, humiliation, fasting, and thanksgiving by presidents of the United States. There have been 60 presidential proclamations for a National Day of Prayer because every president has signed these proclamations. Today is the National Day of Prayer. Please pray for this nation and its leaders. I'm Kerby Anderson, and that's my point of view.
For a free copy of Kerby's booklet, A Biblical View on Socialism, go to viewpoints.info/socialism. That's viewpoints.info/socialism.
You're listening to Point of View, your listener-supported source for truth.
Continue our conversation today with Rachel Gilson. Her book is entitled Born Again This Way, and it's about 140 pages. We have information about it on our website, endorsed by a number of people that we've had on this program in the past. And Rachel, I don't know how many people became Christians at Yale's Sterling Memorial Library, but apparently it made a difference in your life. And you then talk about the change in one sense, but the lack of change in somewhere else, because you said it was if the sun of the gospel had evaporated my atheism in an instant. But as you say, as time went on, one reality remained, a stubborn puddle. I was still sexually attracted to women. And so tell us a little bit more about that.
Yeah, as I got involved in the Christian community after I gave my life to Christ, I discovered so many wonderful things in that biblical community. I was opened up to the Word of God. I was opened up to prayer. I started seeing wonderful things. But it became pretty clear to me early on, well, gosh, my attraction to women hasn't gone anywhere. And it's been about 16 years, and I'm married to a man. But my attraction to women hasn't gone anywhere. And so over the course of my life of discipleship, I've been trying to figure out, how do I appropriate what God has said yes to in the Scriptures and what God has said no to, so that I can thrive in Christ, even though this part of my flesh remains.
Well, it seems to me that that's something the Apostle Paul struggles with. I mean, even in his discussion there in the book of Romans, I do the very things I hate. And individuals that think that the moment you become a Christian, you're going to be perfect and there will never be any more temptations are living in a dream world, because I think sanctification, to use a big theological term for just a minute, takes a long period of time. And in some respects, there are aspects of who we are or the things that have influenced us in the past are there. And so the real question, I think, really that you're asking throughout the rest of this book is, okay, how do I do things where I am obedient to God's word and still experience spiritual flourishing, right?
Yeah, that's absolutely right. Because I think all of us have places where, well, we feel temptation to do things that God has said no to. Now, God has freed us through the death of Christ for the guilt of all sin. And temptation is not itself sin. So, we're not morally responsible for the fact that we experience temptation, but we are morally responsible for how we respond to those temptations. And gosh, that's, a lot of what we seek help for each week as we go to church together, as we read the scriptures together. We're trying to figure out, what do we do since we don't yet live in the new heavens and the new earth where all temptation to sin will be removed? We're still here. Like you said, Paul often referred to, or at least one time referred to, that thorn in his flesh that he asked the Lord to take away. And God said, no, my grace is sufficient for you, for my power is made perfect in weakness. And I think many of us who experience same-sex attraction have found, well, God hasn't taken away, but he has shown himself powerfully strong right in that place to be able to say yes to him and no to our desires.
Talk about your relationship with your husband, because you are married, have a husband and a daughter. And in some respects, you were like, okay, these are just friends. I've never really thought about romance in that sense, but obviously you had to think through some issues that, frankly, some of our listeners haven't had to. But I know there are probably people listening right now that say, yeah, I've got the same question for Rachel that you're asking right now. How did you work all that out?
Well, so the nice thing about my husband's name is Andrew, and, he and I met on the same summer mission trip, and so he heard my whole story. He knew my background, which was helpful. And then several months later, he decided, I really like her. I'm going to pursue her through dating. And I thought, are you crazy? He's a good Christian boy. I've slept with more women than you ever will. I tried to put him off, but he thought, no, but Jesus has forgiven you. How could I hold that against you? And as we know each other more closely, and I was willing to at least give it a shot, I thought, this is a good man. Our faith lines up in the same way. We certainly seem compatible. I do think there's a little bit of attraction here. And really the question was, some of the relationships I'd had with other young women really seemed full of fireworks and explosives, the kind of thing you hear in songs and movies about romance. And the thing I had with Andrew seemed real.
Seem to have lost you there. Maybe we'll see if we can get her back. But again, we're talking about the book Born Again This Way. Now I think we have you again.
Oh, sorry about that. I had his spot. So I was just trying to reflect on the fact that maybe you don't need to build marriage on romance. Maybe it can be built on steady love. Maybe it's actually designed to be a covenant that goes the distance, not just an infatuation that burns itself out quickly.
And if you think about this, that was what marriage was for a very long time. Arranged marriages, situations where you worked together, where you grew to love each other. And this Hollywood ideal, if you will, which I think is a false ideal of a romance, doesn't work very well, because sometimes those romantic expressions and feelings fade away after a couple of years. This is the old guy talking right now about the fact that, you have to rekindle those relationships and everything as well. So in some respects, your book really reminds us that marriage isn't the finish line, it's the starting point. And you do a real good job of really helping people kind of think through what that really means, and to make sure that we take a biblical view about relationships and marriage, not the world's view of marriage and relationships.
I think that's right. And I think actually all of us consider, whether we're entering into marriage or counseling others thinking about it, to enter into it more sober-mindedly, to really consider what it means, to kind of maybe take a step away from just oh gosh, well, I just feel all these feelings, so I've got to go for it. Those don't always sustain you forever.
Let's see if we can talk about what you're doing now with Crew, because you are on the leadership team, theological development and culture. And in some respects, I would think this would be a real encouragement to some other listeners out there that say, I got some same-sex attractions, and I just wonder, am I just going to have to live a lonely life? Obviously, you're not. You're married, have a child. You're involved in a full-time ministry. So what kind of hope might you give to some of our listeners that maybe would like to sit down, read this book in its entirety, and begin to think through what that means for them in their life?
Yeah, well, I would say that, for people who experience same-sex attraction, a call to Christ, just like for every disciple, is a call to die to some things. But God has also promised, I love that parable where it says, the man who found the treasure in the field, and he went and sold everything so that he could buy that field. Like, we certainly do say no to some things when we enter into discipleship, but there's also saying yes to many things. And so it's not a call to loneliness. Whether you remain single or you enter into a marriage, God has promised that the church is to be the family of the disciples, right? That there are friendships and deep intimacies to be had in the church body, whether you marry or not, that there is joyful service to be given in the Lord. God has given every single saint gifts that they are to use to build up the church. And so if we are able to claim the power of the Spirit, then we're going to be able to say no to temptation and yes to the opportunities God has given us to share the gospel in the world, to do acts of mercy, to be really his salt and light wherever he's placed us.
And one of the things I love about your blog that you had last month was to truly live, I needed to die. I've been crucified with Christ. I no longer live, but Christ lives within me. The life I now live in the body, I live in the faith of Son of God who loved me and gave himself for me. And so in some respects, what you're really talking about is that we all die to certain aspects of ourself, and that is certainly one of the themes that runs through your book. So let me just real quickly encourage people to go to your website, because your website, first of all, has information about the book and a way in which people can contact you. And I suspect there may be some people listening right now that say, you're really telling my story, and I'd like to chat with you, maybe correspond with you. So again, it's Rachel Gilson, and it's Gilson. But again, you have all that on the website, pointofview.net. This new book out, Born Again This Way, coming out, coming to faith, and what comes next is something that I think would be a real encouragement to you if you're struggling with this or trying to think your way through this. But even if you aren't, you may know individuals that would benefit from this. So that's one of the reasons I wanted to put Rachel on today and give you a chance to know that this book is out, and it really gets into a lot more depth into some of the things we've talked about. So, Rachel, thank you so very much for giving us some time today. And thank you for writing the book. What a great benefit that this is going to provide for the body of Christ, as so many young people today are kind of struggling through their whole sexual issue, and you've done a good job of writing about it. So thank you for joining us today on Point of View.
Well, thank you so much. Thanks for having me.
We're going to take a break, and when we come back, we're going to spend just a little bit of time before the hour is up looking at a couple of things we need to learn about in terms of what is happening as we come out of lockdown. So I want to pass a few of those ideas on to you. You can find not only the information about the conversation we had with Mark Hitchcock in the first hour, but also the conversation with Rachel Gilson. And when we come back, we're going to talk about normal or new normal, maybe 4 things that make the pandemic worse, and maybe a couple other issues we'll put on the table. All that coming up right after these important messages.
(2020). Is there anything important happening this year? Well, not unless you consider major disputes in various Christian denominations, international tensions over a flu epidemic, economic uncertainties, and a presidential election important. Question: where will you get real news, credible opinion, clear biblical thinking on the things that matter most? Answer: Point of View Radio with Kerby Anderson and the team. You can make sure their voices continue speaking loud and clear by taking a moment right now and joining the Truth Team. It's easy, but you do have to visit our website or make a quick call. Go to pointofview.net/team or call 800-347-5151. You have the power to make a difference. Joining the Truth Team can help ensure that millions of people will get a different opinion from the major purveyors of fake news. We don't get big advertising dollars like the networks or tax money like PBS. We depend on you. Pointofview.net/team and 800-347-5151. Point of View will continue after this.
listening to Point of View. The opinions expressed on Point of View do not necessarily reflect the views of the management or staff of this station. And now, here again is Kerby Anderson.
Back for the final half hour. If you'd like to join our conversation, 1-800-351-1212. Let me again encourage you to maybe watch some of the material that is available tonight on the National Day of Prayer. It's so unfortunate that we can't gather together and pray for this nation, but we can individually. And a couple of virtual events, one that is on Facebook, one that is on television, Daystar and a number of others. TBN will be carrying different ones that you can find out about, and those are great resources that are available to you and an opportunity for you to not only hear from many speakers, but to pray for this nation. So again, some good material that is out there. And if you want to, of course, sign up for our Pray for America events, from time to time we give you some prayer targets. Simply click on that button that says subscribe. My Viewpoints commentary today is, of course, a little bit of the history on the National Day of Prayer. Well, let's talk about coming out of lockdown. And the first issue has to do with this so-called new normal. Turns out that for a lot of people, the new normal is normal. And a good way to illustrate this is to look at some of the numbers that have come down in terms of how many counties in the country have had 0 coronavirus deaths. Nobody has died from COVID-19 in these counties. Well, that's 1,639 counties, or 52% of the counties in America. Now, it's not 52% of the population, because some counties, of course, in New York and Los Angeles and places like that, of course, have a much higher population. But it is interesting to see that more than half of the counties in the United States have not had one death from coronavirus. So that's something to think about in terms of the article that I posted yesterday on the fact that all of us should not live under New York rules. And that was written, interesting enough, by Brett Stevens, who lives in New York City and writes for the New York Times. So even he was recognizing that to be the case. If you add those counties that have only had one death from coronavirus, that's an additional 447 more counties, or 14%. So if you add the 52% and the 14%, that's 66%, or 2/3 of the counties in the country have had one or no deaths from the coronavirus. So you can kind of get the sense that in some respects, these deaths are in very localized hotspots. And a good way to look at this, another way, is to look at some of the material that came out just on May 4th. Now, I recognize we're a few days after that, but on May 4th, using those numbers, New York and New Jersey accounted for 38% of all the cases and 48% of all the coronavirus deaths. If you look at 5 states, which would be New York, New Jersey, Massachusetts, Illinois, and California, it accounted for 54% of all the cases and 61% of the coronavirus deaths. So that is, I think, significant. The first article I've posted here comes from Brandon Morse, and he was criticizing in part the comments by the governor of the state of California, Gavin Newsom, who was saying we're not going to go back to normal. And he says we're going to go to new normal. Newsom talks about this, and I guess the way he put it is we're not going to go back to normal. He said on the Tuesday's press conference, it's a new normal with adaptations and modifications until we get immunity and vaccine. And he's concerned that what this might mean is that we're going to have all sorts of restrictive lockdowns throughout, in his case, the entire state, when many of those counties in the state of California, many of those counties around the country, do not necessarily need that kind of lockdown. And frankly, as we're coming out of lockdown anyway, some of that immunity hopefully will develop. It's called herd immunity. I don't like the term, but that's the one that they use, so we'll have to use it as well. And so what he has said, at least Brandon Morris has said, is that these are individuals that may not give up some of their authoritarian control without a fight. And whether you look at California, New York, Michigan, a couple of governors that maybe have wanted to exercise a lot more authority or control than maybe is justifiable, he says that will be a fight that you will be engaged in. But he also points out interesting left in this piece that some people might just get used to this, and that's, I think, the bigger issue. He said, I've written about how human nature will eventually cause the people to forget precautions as they get used to living with the virus, and more information dilutes the fear around it. So this could go one of two ways. Some people say, wait a minute, I can't stand it anymore. We got to go out. We're going to break the law if we have to. And, of course, you've had some people that have been handcuffed. We talked the other day about Shelley Luther, who is actually in jail right now because she opened her hair salon. But I also think some people are just simply going to go along with that. They're going to be so used to those kinds of restrictions that they sort of take them for granted. And a good example is if you can remember what it was like to fly, say, in the 1990s and compared to what it's been like over the last 20 years, it's a stark difference, because once we started having terrorist attacks, all sorts of things from being inspected, having to remove our shoes, our belts, and just all sorts of stuff illustrate that sometimes people kind of just get used to this. So I think the question that Brandon Morris is raising is, will we go back to normal? Well, we may not, because people will just simply say we can't live in terms of what used to be normal. And a good illustration of that, before we take a break, is one that I haven't posted, but maybe I'm going to do a commentary on it, and that has to do with these numbers, which I've been hearing for days, so I took the time to dig them up. And that is, there have been some surveys, and this one is a survey of 1,000 American adults that were actually trying to figure out what will happen after the lockdown. And according to their research and their survey, they found that about 40% of Americans plan to avoid public spaces until it's absolutely necessary, which means for them it would be long after the coronavirus pandemic has subsided. Now, again, this is a survey of just 1,000 people, but I know enough to know that if it was a randomized survey, let's hope that it was, it gives you a little bit of a snapshot, and I recognize that some people give you an initial reaction that maybe changes over time. But what they found, for example, is that this makes sense, that 4 out of 5, or 82%, said they're much more aware of and concerned about the cleaning protocols in public areas. About 58%, or a majority, would say they would be suspicious of their friends' or family's hygiene habits. And I love what John Andrew, who writes about this, says, well, next year's Thanksgiving could get real interesting. Then here's something. Well, you do begin to open up and we stop some of these lockdowns. What will people do? They found that a third of the people they surveyed said they'd wait a few weeks. Even if you open it up today, it'll be a few weeks before I really get out in the public and even come close to something that looks like normal or the new normal. 26% said they'd wait 1 or 2 months. And a few of the respondents, 16%, this is a number I was using with my wife the other day, said that they're unsure whether they would ever feel comfortable going out in public again. Now, think about that. That's 16%. Now, you might say, well, that's not me. I mean, eventually, I think I would want to get out again. But 16% say, I'm not sure I'm ever going to get out again. Now, that may change over time, but some of that 16% may be people that are already seeing themselves as high risk. They're in a nursing home, they're in a special care facility, or they've had various problems over the years with asthma, or maybe they more than once have gotten pneumonia, and they're just saying, I'm not sure I'm going to go out. In that percentage also are people that maybe have had agoraphobia. And they're the people that agora, meaning open, phobia, they're afraid of going out. And has this lockdown made agoraphobia less likely or more likely? I think you know the answer to that one. And so that's kind of an intriguing issue as well. Just a couple more before we take the break. 83% of Americans said they would be more inclined to buy chemical cleaners. More of the respondents said that they would hold businesses accountable for how they clean spaces. And a majority, 51%, said they would not patronize establishments that aren't transparent about their cleaning practices. Nearly half of the respondents believe all businesses should make hand sanitizer widely available. That's 92%. If you got a business right now, you're in a store, you better have hand sanitizer. 92%. 78% think businesses should hire more cleaning staff. And then what about schools? A significant portion of these individuals are worried about their children's safety. Over a quarter, 27%, said they'd wait a few weeks before sending their kids back to class. 24% said they wait 2 months. Just imagine if the schools open in August, like they're talking about, maybe early. Some of the parents say, that's fine, you can open the classes in August. I'm not sending my kid to school in August, maybe September, maybe even October. That's an interesting look at what are some of the concerns in the minds of individuals. Like I said, some of it might change, but it illustrates again that maybe we are headed for a new normal. I'll talk more about some of the things that make the coronavirus pandemic worse right after these important messages.
Now, back to Point of View, your listener-supported source for truth.
Back for a few more minutes, let me just mention that tomorrow we're going to have our weekend edition. Penna Dexter and Dr. Merrill Matthews with us, and Penna Dexter has written a commentary that you'll certainly want to hear. Dr. Merrill Matthews has a very good article that appeared in The Hill looking at some of these models that haven't turned out so well, and he will spend some time kind of taking us through what we can and cannot learn from models and what we should trust and not trust about those models. So some great material that we'll be covering tomorrow, as well as just look at a couple of other stories that we've been following for some time. So I hope you'll join us tomorrow. And again, if you find yourself saying, I'd like to know a little bit more about some of the things you've been talking about, those articles are available on our website. And one of the other articles that I've posted for you today is an article that came out in USA Today. It talks about, by Glenn Harlan Reynolds, a number of the lessons on density, mass transit, bureaucracy, and censorship. Essentially what I call these 4 things that make the pandemic worse. We've learned this, and we sort of know it, but it's always good to rehearse it one more time. And the first one he mentions is density kills. Well, we sort of just illustrated that a minute ago. He says the coronavirus has been much more deadly in places like New York City or Boston. The demographer John Kotkin, who I'm going to quote from a little bit later this article as well, notes that Los Angeles has done a much better job than other big cities because it's less dense. And so when you look at a very dense cities, we just talked with Rachel a minute ago, she lives in Boston, or you think of New York City when we talk with Eric Metaxas, or you think of Chicago or a number of others where there's a lot of population density, that in many cases makes it worse. In recent decades, the dispersed model, which has oftentimes been criticized by politicians and even environmentalists, actually tended to be something that kept you much safer. So when you compare the most populous city, New York City, to the second most populous city, Los Angeles, you see a striking difference, and so density kills. Number 2, the other part of that is mass transit kills. Kotkin, who I mentioned just a minute ago, mentions mass transit and an MIT study that found that the New York City subways were a major disseminator of the coronavirus in New York City. And, of course, that's not surprising. If you've ever been to New York City, you ever been on the subways, they're crowded, they're poorly ventilated. Only recently has the city begun to clean them. I can't even imagine that they haven't been doing that. So that, of course, makes it very difficult for anything that looks like social distancing. Whereas if you're driving a car, just think about that. When you're in a car, you're riding in kind of a metal gold bubble with filtered air and those kinds of things. So in some respects, where people survive by driving in their cars compared to people who survive by taking buses or subways, you can see the difference. The third point he makes is bureaucracy kills, which I think is really striking because it is true that indeed much of the fight against the coronavirus also involved, he says, a fight against the bureaucrats who were dead set against making things worse, but nevertheless did. They weren't trying to do this. They weren't mean-spirited individuals. They weren't evil. But he points out that the Centers for Disease Control and Prevention, once they declared the COVID-19 virus or the disease as a public health emergency, that sort of raised the bar for testing requirements. And as a result, those barriers made it even harder to address some of those issues. He has a quote here. James Copland said that the botched regulatory response in the United States owed little to the choices of political actors. The individuals running the FDA and Centers for Disease Control are experts in their field, not hacks. But nevertheless, that's what happened. And then finally, censorship kills. The Chinese government censored reports of the Wuhan coronavirus outbreak, punishing doctors who talked about it, lied to the world for weeks, while allowing flights from the infected area to carry people from Wuhan to all over the world. And so, again, the implication of that is don't trust China. Don't trust Americans who want to emulate the Chinese government. Neither has your interest at heart. And so nothing else. Glenn Harlan Reynolds spent some time really talking about that, and that is his piece that appeared in USA Today. Just before we end, I wanted to mention this, but we will probably get to this tomorrow, and that is we are starting to see many of these lawsuits surfacing, and there's been a real discussion in the part of Congress. Especially right now, there's even a bill in the Senate, I believe. John Cornyn is the author of it. I think I have it here somewhere, that really wants to try to provide some protection. But here from our friends at the Wall Street Journal, they say governors are moving to reopen their economies, and Congress should at least do its part. That includes passing the liability protections that business owners need to feel confident they won't be looted by lawsuits as they get back to work. And then they give the long list of trial lawyers are already filing suits on emergency supply manufacturers for false advertising, suits against colleges for refusal to refund student fees, lawsuits against cruise lines. You can understand if somebody loses their life, but even for emotional distress, if you can believe that. Lawsuits against retailers for wrongful death. Lawsuits against nursing homes for negligence, and lawsuits against government for the denial of hazard pay. And so right now, some of the governors have used emergency powers to grant some liability protection to healthcare workers, because after all, some of them didn't even know what they were getting themselves into, and you cannot criticize them because they didn't have personal protection equipment. And you can't hold the hospital responsible, I don't think, because they didn't have enough PPE, or it got used too quickly, or it gotten given away, or who knows what, or some of it was stolen, by the way, we found out as well. And so they say one obvious step to eliminate frivolous lawsuits is to only apply those to serious injury, because law firms right now are filing lawsuits against cruise lines, arguing that even passengers that did not contract the virus were subject to emotional harm and entitled to punitive damages. And I think most of us would say that doesn't fit. It's going to be hard to prove any of this anyway. Let's talk about this lawsuit right now against the Chicago area Walmart, where there was a worker that died back in March from the virus. Because, first of all, Walmart has stressed that it was trying to protect its workers and customers. But more importantly, it's almost impossible to prove that the individual died because they contracted the virus in the Walmart. Given the movement they had, they could have picked it up from friends, family, bus lines, all sorts of other things, subways. That just is difficult. So the real issue is not that sometimes people will win a lawsuit, but that it just becomes a nuisance suit. And as a result, that becomes enough of an impetus for individuals to try to settle out of court, or just even if they try to defend themselves, just additional costs. And guess who ends up paying those costs? Well, those of us that shop at Walmart or wherever that lawsuit happens to be. And, of course, another one we'll talk about tomorrow, because that'll get into some of the things that Dr. Merrill Matthews is involved with. Can businesses be held liable for violating health privacy, so-called HIPAA laws, if they alerted the workforces to the individuals that had come down with the virus? And so you've got privacy issues, you've got legal liability issues. This is another part of that so-called new normal that does not bode well for the future. So we'll continue to look at these things here at Point of View. And if nothing else, I'm just hoping that you will take the time this day to pray for this country, to pray for our leaders, and to pray for the health of the American citizenry, because we are in the midst of this. As we come out of lockdown, let's see where that leads us next. If you find yourself saying, I want to read some of this, we have it posted on our website, including a very good piece that came out about Adam Schiff, the things that he said and how what he said didn't fit with the facts. So we've got all of that from justthenews.com as well. I want to thank Andrew for his help behind the scenes, as well as for Steve. Hope you'll join us tomorrow on our weekend edition right here on Point of View.
Having civil conversations about important issues seems to be harder and harder. Various media outlets tell people what they should believe, why they should be outraged, and getting people to actually think, well, it can be difficult. Whether it's the gospel, tax issues, social policy, or just about anything else, you need to have solid information and clear thinking to address the hard issues. You need God's truth applied. And that's what you get in less than 2 minutes with Point of View's Viewpoints Commentary, a daily resource to help you be informed and think through the things we need to be talking about. It is free and will arrive in your inbox each day when you visit pointofview.net/signup. Sometimes we know we should say something, but we're silent because we're not quite sure what to say. Viewpoints Commentary can help you break the silence and change the narrative. It can make you a more equipped agent for truth. Get your free subscription to the Viewpoints Commentary at pointofview.net/signup. pointofview.net/signup. Point of View is produced by Point of View Ministries.